Hello, everybody. I'm Iman Youssef. I'm a TA in Penny Swift University, so he introduced me. So my research was to study and to produce novel immunization strategy against multi-drug resistance, especially gram-negative bacteria, using, as I said, novel antigen. So I was working in Harper UCLA, as we are affiliated from Harper, from hospital. So our interest in our research lab was hospital-acquired pneumonia. So as you know, pneumonia, it is a disease that affects the lung and the respiratory system. And it can be cured easily, but the issue is the hospitalized people have low immune system. So when you have a low immune system, so the bacteria can easily invade you and infect you and may cause death. So you can see here in the statistics that about 33% mortality due to this pneumonia. So as I said, gram-negative bacteria is the main cause of this. Especially there is Acinetobacter baumannii as strain and Klebsiella pneumonia and E. coli and other strains. But we are, in this study, we are interested in both Acinetobacter baumannii and Klebsiella pneumonia. Multi-drug resistance increasing day by day, and it is hard to cure the disease by the normal and traditional antibiotics. Acinetobacter baumannii resistant to almost all conventional antibiotics, and also Klebsiella pneumonia now possess a new plasmid that can be resistant to most of the antibiotic classes. So what is HYR1? What is the novel vaccine candidate that we are interested in? So HYR1, it is an abbreviation for hyphy-regulated cell surface protein. So it is a candida antigen. This antigen is present on the hyphae of the candida. So we are using a fungal antigen to treat the bacterial infection. So this is novel, right? This is very weird at the beginning. But what we make us interested in doing that is that there is some 3D homology between HYR1 antigen and OMP-A antigen on the Acinetobacter. So Acinetobacter has antigen, OMP-A, which is important in virulence of this bacteria, which is quite similar to in the 3D structure for HYR1. So we got interested to know if this HYR1 can be used as a passive immunization mainly in this study. So in our methods, we produce monoclonal antibody. As you all know, that passive immunization means that you produce the monoclonal antibody and to treat the person with this monoclonal antibody against this kind of antigen. However, the active immunization is to give the antigen, the immunogenic antigen, and make the body do its own immunity against this antigen. So here in this study, we used the monoclonal antibody. We have the recombinant HYR1, and we use this to immunize mice and collect their spleen, as shown here in the picture, in this diagram. So we immunize the mice with HYR1, and then we collect the splenocyte and fuse this with tumor cell to produce hybridoma, and then we collect the supernatants that containing monoclonal antibodies and go through purification of this monoclonal, identification, characterization of these monoclonal antibodies, and then testing it in the animal models against two kinds of bacteria, which is Acinetobacter and Klebsiella pneumonia. I didn't go in details because there's a shortage of the time, so one of the main experiments that's important here is to know if this monoclonal antibody can recognize the cell surface of these bacteria, either Acinetobacter or Klebsiella or not. So it seems that yes. So here in this diagram can show that there is a very good binding to both Acinetobacter and Acinetobacter and Klebsiella pneumonia to this monoclonal antibody. So the monoclonal antibody can recognize the cell surface. This is binding assay. I use the flow cytometry technique, and we use the anti-FITC secondary antibodies to show us this binding. Then there is a lot of in vitro data I didn't show here, but before we go to the animal test disease, there is several in vitro data that we had before we go to test this into the animal. So here we have two models during biopsy.
1 minute, please. 1 minute.
1 minute? Sure. So we have two we have two bacteria. So we have two models. I established one model for Klebsiella, and we use this model to test the different monoclonal antibodies. And here you can see that there is a very nice protection, the green one and the red one, when you administer the mice administered the monoclonal antibody twice for 2 doses versus the placebo. And also for Acinetobacter baumannii, different model. So also you can see 100% of one of the monoclonal antibodies that can protect from lethal dose from Acinetobacter baumannii. There is a lot of future plans about this work to know what is the cross-reactivity of this, why they are cross-reacted with, what kind of antigens that cross-react with. In other words, so what is these Klebsiella and these Acinetobacter antigens that cross-react with HR1? I started to do part of this, but the lab will continue this work. So I'd like to thank Sure Fulbright for giving me this opportunity to increase my experience and to do the work that I dreamed to do. And also I'd like to thank the labs that I worked for 1 year, Dr. Abraham from Harvard UCLA, and our good family that I had, and NIH that support and funds this project. Thank you so much.
Thank you.